Donning and removing PPE, personal protective equipment. Donning means to put on. So, one of the things you want to first look at is the type of gown you may have to use on that day. They come in different colors, different styles. You want to check to see, is it a tie or do I have to use Velcro? Because again, you want to know how to put it on and take it off. And then, of course, you're going to need your gloves. You'll also need your biohazard bag and a trash can. Okay? So, first thing you're going to do is pick your gown up, put it on. Just slip it over top of your clothing. Now, hi Drew, it's Kathleen, your CNA. The nurse asked me to come in and give you a modified bed bath. Okay? I'm going to get the equipment and we'll get started. First, you want to make sure, of course, you provide privacy. Now keep in mind, this skill is called modified bed bath. So you just want to do what they're asking for. In a modified bed bath, you're actually washing your eyes, their face, their arm, their hand, and underarm. It's not a partial bath, it's not a complete bath. Those are totally different types of baths. So for testing, this is called a modified bed bath. You also want to note the equipment that you need for this skill. Once again, of course, you have your wash basin, you have your soap, gloves, a washcloth and towel, and a clean gown. Now we're ready to start the skill. Now before we start, we want to make sure that we maintain privacy and keeping Drew covered up at all times. I'm going to first make sure that I remove her gown that's on and just kind of get that out of our way. Again, remember, you're taking off linen, so you don't want to put it next to your clothing. Just turn it inside out and just lay it there out of your way for a moment. Okay? Now, go ahead, Drew. Can you push your sleeve up for me? Because I want to make sure whenever I get to your arm, there you go. Thank you. Now, I'm going to go ahead and put my gloves on in a moment, but the first thing I want to do, because I have water here, I've already tested to make sure it's okay, but I want to check to make sure it's okay with Drew. So we'll have her test the water and verify it's okay in regards to comfort. Is that okay? All right. Now, before washing, there's those key words before, you want to make sure you put your gloves on. Now, I'm going to start with her eyes. So I'm going to wash her eyes first and then her face. Notice that I'm not going to put soap in the water. And when I'm washing her eyes and face, I'm not going to apply soap. Many of your patients are allergic to different types of soaps, and the skin is extremely sensitive, so you don't want to put soap on the face. So I'm going to wet my rag. Now I'm going to make a mitt. And the purpose of this mitt, when I'm doing her face, is so that we don't have just loose ends that can cause an injury to the eye. So we'll make a mitt on our hand to prevent that from happening. So you just want to fold it around, cup it under, and you have your mitt. You're going to start with the eyes. We always go from inner to out, okay? From white, inner to out. You want to use a different part of the rag when you do the other eye. And now I want to wash the rest of her face. Again, modified bed bath is all you're doing. If I was doing a complete bed bath, I would do a lot more steps than what you're seeing right now. And we're going to make our mitt because we're still up at the face. And then you just want to wash their face. Nice and smooth. Lay this here across my back basin. You're going to take your towel. You want to nicely just blot dry. Blot means to pat. You don't want to rub the skin, remember? You want to just blot it dry. Just pat it nice and dry. Okay. Now, we're ready to do her arms. Okay? So I'm going to have her lift her arm for me. And you're going to place this towel up under there, and that's to prevent her bed from getting wet. And then I'm also going to use that to dry her arm and her hand. And of course, her underarm. Now, with washing her arm and hand and underarm, we're definitely going to put soap on the rag this time. This time you don't need a mitt because there's no area that's in risk of being injured or anything. Okay. Soap on there. Now we're ready to wash her arm. Just wash it all over. Wash their hands really well. Between their fingers. Okay. And you want to make sure you get up under their arm really well. Now remember, the skill says arm, hand, and underarm. On test say if you just wash the arm and the hand, don't wash under the arm, you're going to get a no for that step. Remember, you can't do part of a step. You must do the entire step. Now we're going to rinse the exact same way we did in regards to washing. We're going to rinse her arm off all over. Rinse her hand. Don't forget to go in between her fingers. And of course, we're going to rinse under her arm. Okay. Now we're going to pat dry. Make sure you dry her hands really well. Remember, the skin doesn't like moisture, so we'll make sure it's nice and dry. Don't forget. To dry under the arm as well. Okay? You can lift it just a second. I'll take it out of there. Okay? Now we're going to go ahead and put another gown on. Still maintaining privacy, so you have to keep it covered up. Can you put this on for me? Alright. Once you've done that, now we're ready to go over to the sink and we're going to empty, rinse, and dry our basin. Okay? So, and we'll come back and get rid of our linen. So let's go over to the sink at this point. Okay, so now we're going to empty, rinse, and dry our basin. Remember, once we've done that, we're going to place it in the designated dirty supply area. Okay? And now we're going to go back and get our linen. Okay? So we're going to get rid of our linen. Once you've done that, now you're ready to remove your gloves. So we're going to take our gloves off, throw them away. You'll say at this point, I will wash my hands. In reality, we didn't wash our hands. Then you're going to give her her call signal. Drew, we're all done. Here's your call signal. Just give us the call if you need us, okay? The bed, of course, is in its lowest position, and now the skill is complete. Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and provide some perinatal care for you. I'm going to get the equipment and we'll get started. You want to first provide privacy. One of the things you want to remember, of course, is making sure you have your proper equipment. So we have our wash basin of water. We have our gloves. Notice in this one we have 2 washcloths. You're going to use one for washing and one for rinsing. We have a towel and we have an incontinence pad that's going to go up under. Now, if you don't have an incontinence pad, another towel would be okay to utilize in this skill as well for the pad that will go under it. Now, of course, we've already checked our water. So we want to make sure that our patient checks their water. So on test day, you say to the patient or the mannequin in this case, Ms. Smith, would you check to make sure this water is okay? Okay. And now again, you have befores. And of course, we're getting ready to provide care. We want to make sure we put our gloves on first. Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and take your blood pressure. Okay? I'm going to get the equipment and we'll get started. You'll notice for equipment, you're going to be using a standard blood pressure cuff. A lot of your facilities now, of course, use electronic equipment, but for testing purposes, you don't have that option. You must use manual, okay? So you want to make sure that you understand how the equipment works. This is what we call a teaching stethoscope. So realize that the evaluator is going to be listening at the same time you're doing your blood pressure. One of the things you want to make sure of is that you clean these off very good. You want to clean the ears as well as the bell. Those are steps that are very important when you're taking the blood pressure. You're going to use alcohol swabs. This is your standard blood pressure cuff, and so we're going to put this on. One thing you want to make sure of, when you place this on your patient's arm, notice that it has the arrows. Many of them have that, and it lets you know where to place this over the brachial artery, and that's real important. So we want to make sure that you note that whenever you see me doing the demonstration. Also, when you're taking the blood pressure, you want to make sure that the arm is bare. You always want to take a blood pressure over a bare arm. You never ever take blood pressure over clothing because you're going to get a false reading when you do that. Also, you want to locate the brachial pulse. Now that's located in the inner aspect of the arm, right above the elbow. And so you want to find that because that's very important because that's where this bell is going to be placed in order for you to hear the sound. When we're taking the blood pressure, we're listening for the first and the last sound.
Now you want to make sure again that the arm is face up and that the arm is bare. The first thing we're going to go ahead and do is clean off our stethoscope. So you're going to clean off the ears. And also, like I said, you have a teaching scope. So on test day, you may want to clean off the evaluator's ears as well. Usually they clean their own, but it's okay if you do that. Now, one of the things that's important, when you're taking a blood pressure, how you place these in your ears make a world of difference. If you don't have them in correctly, you will not hear the blood pressure. Let's say you're in the midst of taking your blood pressure and you make a mistake and you've forgotten something. Don't panic. Just take it over. You're allowed to say to the evaluator, I need to do a step over. Just do that step over and pick back up where you left off. The first thing I'm going to do after cleaning that off is actually put the blood pressure cuff on. Ms. Smith, I'm going to get you to slide your arm in here for me. Thank you. Now notice that this is her right arm. So this arrow that's here is going to go right over that brachial artery where I found that pulse, okay? So you want to put this on and make it tight around the arm, snug. Okay, you can relax your arm. Thank you. You want to make sure that you can see everything you're doing. Now we're going to make sure that the valve is closed, okay? And we're ready to take her blood pressure. You want to make sure these are turned inward, not backwards like this, because you wouldn't hear anything. You want to make sure they're going inward for your eardrums. So you put this in. You also want to tap it. If you can hear something when you tap it, you know you have it incorrect. Now let's place it over here. You want to make sure that's flat over that brachial artery. And now we're going to inflate the cuff up between 160 to 180. And slowly deflate and start listening. Slowly turn the valve towards you. You're in control. Once you hear that last sound, you want to release all that pressure off that brachial artery. One of the things I want to point out to you as well is when you're taking the blood pressure, if when you first start to deflate it, you hear a sound right at the 160, between 160 and 180, you want to deflate it all the way down, and then you're going to inflate it back up to 200, because that means that there's a beat that you may have missed because it's so high. So you don't want to miss any beats. So you want to make sure that you capture every sound. So you want to remember that, okay? Now we're going to take the cuff off. Thank you, Ms. Smith. You okay? All right. Slide this off. Thank you. Okay. All right. Now here's your call signal. If you need us, you just give us a call, okay? Again, if you raise that bed up, you want to make sure that you left it in the lowest position. Prior to documenting our blood pressure, we're going to make sure that we wash our hands. And then, of course, we'll put our equipment away once we cleaned it. That ends that scan. Hello, Ms. Smith. It's Kathleen. The nurse asked me to come in and get your weight, okay? We're going to get started with that procedure in just a moment. One thing you want to remember and really understand is how to actually record a weight when you're using a stand-up scale. One thing you want to notice that down here at the bottom you have your base weight, 0 to 300. You're going to add that to your top weight up here, which goes from 0 to 50. The even numbers are on here for you. However, the odd numbers are not. So you want to make sure that you're able to read this. It starts off with 0 and then it goes in quarters, 1/4, 1/2, 3/4, and the 1 is understood. And then from there is 1/4, 1 1/2, 1 3/4, and then the 2 is here. You'll just add these two numbers together, okay? You also want to make sure when you're getting a weight that this balancer is centered, okay? So when you're done with that, getting that person's weight, this would be centered right here. And that's how you'll know that you have the person's weight, and you'll add those numbers. We're going to start the procedure at this time so you can see exactly how that's done. Ms. Smith, what I need you to do, if you would, sit on the side of the bed for me. With this skill, you want to make sure that your patient has on shoes or some type of non-skid footwear, okay? Very important when you walk anyone over to the scale that they have something on their feet that has a non-skid bottom, okay? Is that comfortable for you? Okay. Okay. Make sure your feet are flat on the floor for me. Good. All right, now we're going to walk over to the scale. All right. And I just want you to stand right there in front of the scale for me. Don't step up yet. Prior to having your patient stand up on the scale, you want to zero out your scales. You want to make sure you bring both balancers to zero prior to standing them on the scale. Now, at this time, if you would stand on the scale, you want to make sure that you're assisting them if they need that. Now we're going to start to get her weight. Now we're up on the scale, so you want to bring it from 0 to 100, and then you're just going to start moving the smaller balancer up here, a weight, until it starts to balance. And again, you're waiting to see that it gets centered. If it's too much, it's going to drop down. All you got to do is just back it up. Okay? And you just give it a few seconds to get balanced out. What you don't want is that touching top or bottom. And you just want it centered out. Okay? Once you've gotten that weight, you want to just add the bottom and the top. In this case, you see that it's 100 and it's 36 and a half. Okay? Okay, we're going to have her step off and you assist her. We're going to have her come back to her bed. You want to make sure your patient is safe prior to documenting or anything like that. All right, Ms. Smith, if you'll just have a seat here. All right, and we're going to get you back in bed. Let's straighten up your pillow here. I apologize. Okay, let's take off your non-skid footwear. Of course, if you put shoes on them, you would take their shoes off. You can lay back in bed, Ms. Smith. All right, here's your call signal. Just give us a call if you need us, okay? Of course, the bed is in its lowest position because we did not raise it. At this point, you will wash your hands because you definitely want to make sure that you wash your hands prior to documenting, okay? Skill is now complete. Hello, Ms. Smith. It's Kathleen. The nurse asked me to come in and do some range of motion for your knee and ankle, okay? You don't need any equipment for that, so I'm going to provide privacy and we'll get started, okay? Okay, Ms. Smith. Now I'm going to start range of motion on your knee and your ankle. What I want you to do now is let me know if you have any pain or discomfort, okay? Because if you have any, we'll stop the exercise and let your nurse know, okay? Again, you want to remember anytime you're doing bedside care, in reality, you would actually have your bed at waist level, but for testing purposes, you don't have to do that. But you definitely want to make sure you keep your patient covered up. We're only going to expose the one leg because that's all we have to do at this point. You want to make sure that you're supporting their knee and their ankle. And in this exercise, just relax your leg. What we're going to do is we're going to bend it up toward the head of the bed and straighten it back out. That's just flexion and extension of the knee. Okay, so again, we're doing exercise for the knee and for the ankle. Okay, now at this time, I'm going to bend your knee. Right. You okay? Bring it back down for me. We're going to do it a total of 3 times. Again, we're going to do it. We're going to do it nice and slow. Keep the foot close to the bed. One more time. Good. And again, remember, range of motion exercises are so important to prevent contractures. Okay? Now we're going to do exercises for the ankle. With the ankle, you want to make sure that you're supporting the person's ankle as well as their foot. And we're going to be doing dorsiflexion and plantar flexion. Dorsiflexion is when you're pushing the foot toward the head of the bed. Plantar, just like you're planting something, planting down, you're going to plant down. So the ankle goes up and down, not in a circular motion, but up and down. We're going to do that a total of 3 times. Ms. Smith, again, just let me know if you have any discomfort, okay? You ready? We're going to point up. Good. Now point down. And you have to do it for your patient. So do it again. And it's always a good idea to look at your patient because a lot of times their facial expressions will tell you more about their comfort level than their actual voice. Okay? All right. Very good, Ms. Smith. Thank you. Coming back up. I always want to make sure that your patient is nice and tidied up before you leave their room. And we've done her exercises for her knee and ankle, and we'll make sure she has her call bell so she can call us if she needs anything, okay? Again, you want to make sure that that bed is in its lowest position. And when you're done with that skill, you want to wash your hands as well, and then you've completed this skill. Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and do some range of motion for your shoulder, okay? We don't need any equipment for this. I'm going to provide some privacy and we'll get started, okay? At this time, you want to make sure that you provide complete privacy for your patient. All right, I'm going to take your arm out right here. I'm going to keep you covered up. All right. Now, at any time, if you feel any discomfort or any pain, please let me know and we'll stop the exercise, okay? In reality, you will actually have the bed at waist level when you're doing any kind of care at the bedside, but for testing purposes, you don't have to raise this bed up for that. So we're going to just leave it as it is. But please remember, all healthcare workers should always make sure that that bed is at waist level anytime you're doing care at this bedside, for your safety as well as your patient. Now, you want to make sure when you're doing range of motion exercises that you're supporting the person's wrist as well as their elbow. That's very important. You also notice in the steps as it's going up on the screen, it tells you we're going to be doing flexion and extension. When we do flexion, we're going to raise the arm up to the ear level and then back down, extension. We're going to do that a total of 3 times, slowly and watching the patient at all times. You ready, Ms. Smith? All right, we're going to go up to your ear level. Good. I'm going to bring it back down. How does that feel, okay? I'm going to do that again. I'm going to do it one more time.
All right.
Good. Is that okay? Now it's also requiring that you do what we call abduction and adduction. When you're doing that, that's just you taking the arm out, away from the body, and then bringing it back. Again, you want to do it a total of 3 times. When we do exercises, repetition of 3s is very important because that makes sure that the range of motion exercises are being done correctly and appropriately in regards to making sure those joints are moving. Again, you're going to support the wrist and the elbow. We're going to take it out. 1. Okay. Take it out again. Again, you just let me know if you have any discomfort, okay? We're going to do it one more time. Very good. That's good. One thing you want to remember with range of motion exercises, they're very important for us to do for our patients because they prevent the possibility of contractures. Now, we're going to make sure that Ms. Smith has her call bell before we leave her. So, Ms. Smith, thank you again. Here's your call signal. Let me know if I can do anything else for you, okay? You want to make sure that that bed is in its lowest position. And again, you will make sure you wash your hands at the end. Hi, Megan. It's Kathleen, your CNA. The nurse asked me to come in and assist you with positioning on your side, okay? All right, I'm going to provide privacy. The first thing I'm going to do before we start, I'm going to go over there and let that side rail up because that's the side we're going to turn on, okay? You always want to make sure your side rails are positioned correctly prior to turning your patients for their safety. Now, because Megan is able to assist me in this skill, I'm going to have her help me with turning and positioning her. Now, at this time, Megan, what I would like for you to do is just turn on your side for me, okay? I want you to grab hold to that rail, and I'll do the rest with your pillows, okay? 1, 2, 3. Thank you. Now, some of your patients, in reality, you may have to assist them with turning, but in this skill, you're allowed to have the person help you. You want to also make sure anytime you're turning your patient on their side that you adjust their pillow. Don't just assume that this pillow is comfortable in the position that it was in previously. Megan, if you lift your head up, I'm going to slide it over a little bit. Is that better? Okay. Also, one of the things you want to make sure that you do is go over and check the arm that they turned on. You don't want them lying on that arm. So we're just going to pull this out just a little bit to adjust it. Don't forget to do that because remember, most patients that are turned on their sides are going to be on that side for a couple of hours maybe. So you don't want to cause any type of pressure ulcer. Now we're going to take a pillow and place one behind her back.
And that's just for positioning to help her stay on her side. You want to keep your patient covered up. You never want to overexpose them. So we're going to take this pillow, and what you do is put it behind the back and just kind of fold it under so that it props against them, and they can just nicely relax on that pillow. Now, what we're going to do is we're going to place one between her knees and her ankles. You always want to put a pillow between here because you don't want bony prominence touching bony prominence. That can cause skin breakdown, and that's not good. So we're going to take a pillow and place it between her knees and her ankles. So you want to lift up her little leg like that, place it down. You want this leg flexed or bent, okay? And then you want to make sure it's between the knees and the ankles. Again, you want to keep her covered up in the prop. Six. The other pillow, you're going to take and actually place it here. But hello, Miss Smith. It's Kathleen, your CNA. The nurse asked me to come in and provide some catheter care for you. I'm going to get the equipment and we'll get started. First thing you want to do is make sure you provide privacy. You want to make sure you have the right equipment for this skill in providing catheter care. So you notice, of course, we have our basin of water, we have our gloves, we have our soap, washcloth, and 2 towels. So now we're ready to start the skill. Now with catheter care, you also want to make sure when you see the bullets going up and you see those critical steps in bold, there are 2 critical steps. So you want to make sure that you do those exactly as they're written. So please pay attention to that when I'm doing it, okay? Now, of course, we've already checked the water to make sure it's okay. But again, on test day, anytime you're going to give care and you're dealing with water, if your patient is able to or not, you want to make sure that you try to see if they can verify the temperature. So on test day, you would just say, Ms. Smith, would you check this water and make sure it's okay? Just a reminder to let you know to do that, okay? Before you start your skill, you're going to put your gloves on. Again, your fours are very important. We'll put our gloves on. Now, once we get our gloves on, one of the towels we're going to place up under her to utilize as a barrier so not to get her bed wet. You want to keep your patient covered up, maintaining that privacy. First thing I want to do prior to putting that up under her is I'm going to just push her down up, out of the way, and you're going to be able to see me do catheter care in a moment, but you don't want to overexpose your patient until time. So you want to keep that in mind. So I'm going to take one of my towels, and what I'm going to do is just move this a little closer to me so I'm not reaching. I'm going to take one of the towels. I'm just going to leave it halfway folded, and I'm just going to place it up under her buttocks. Okay? And you'll see the placement in just a moment. But right now, we have to maintain privacy. So you have to, of course, do this with your patient maintaining privacy. Okay? Relax this leg here. And relax this one. Just going to make sure that the towel is up under her properly. Okay? Now, in order to provide this care, I have to expose the area that we're going to be washing. So I'm just going to bring the sheet down
just to her perineal area so that you can see what we're doing. This is the catheter. Of course, you guys know that this is normally connected to a drainage bag, but in this skill, you're just providing catheter care, so that's all you need to see. Now, here's the important things you want to remember prior to doing this. When you're doing catheter care, you want to make sure that you're holding the catheter up here at the meatus. That's very important, because when you're washing down this tubing, you don't want to pull on it, so you want to make sure that you hold it. What you want to do is kind of hold and just kind of push forward, and then we're just going to take the washcloth and go down the tubing. We're going to wash and rinse the tubing. In this skill, you're just providing catheter care, so that's all you want to demonstrate. In reality, of course, we provide perineal care, and then we do catheter care. But again, for this skill, we're just going to demonstrate catheter care. Once you expose the area, now you're ready to actually start the washing. So you're going to take your washcloth. You're going to put some soap on the rag. Okay? You're going to hold up here at the meatus, and then you're going to come down the tubing, gently lifting. Don't pull, just gently lift. You want to change positions of your rag with each wipe. We'll do that at least 3 times, or in reality, of course, as many times as necessary. Each time, changing the position of our rag. Hold and wipe down. You want to rinse that tubing off the same way you wash. Again, critical steps. Hold, lift up, wipe down. I'm going to do it again. You notice in healthcare, we like to do things in 3s. No less than 3. You have to do it more than 3, but no less than. Okay. Now you're going to dry the same way. This time holding, you just kind of gently pick up that tubing and just kind of pat down that tubing. And you know I'm going to do it a minimum of 4 times. Changing the position of the towel each time. Remember, they're watching how you perform this in regards to holding on at the meatus. Okay? Now, it also tells you to go at least 4 inches down the tubing. Don't worry about guessing what 4 inches is. Your finger's like 3 inches. One more indent would be 4. Just go all the way down the tubing. You can't go wrong. Okay? Just a little inside tip for you. Once you've done that, you're going to cover her back up. At this point, we're going to go ahead and remove this towel that's under her. Okay? Now we're ready to go over to the sink and, of course, discard our water. Okay? And then we'll come back and get her situated. So if you would, follow me over to the sink. So now we're going to empty, rinse, and of course dry it out. Now, in reality, when you're doing catheter care, you would want to empty this water into the commode.